So Vedansh, little Vedansh has got spinal muscular atrophy, type 2, which is a disease which is inherited. So he got it from a spelling mistake in his genes, which genes are what make us what we are. So because of that, there's a spelling mistake in the code. So because of that, there's a deficiency in a protein which is necessary for the proper working of his spinal cord. This is a progressive disease. So he's very clever, as you can see. Yeah, he's not letting go of this, but it means that he will get progressively weaker. He's not able to stand by himself, but usually children get weaker as they grow older. Type 1 is much more severe. Type 1 children do not survive 1 to 2 years of age before their second birthday. Yeah, he's type 2 probably. He's type 2 in the sense that he's sitting. So we classify people as type 1, type 2, type 3 and type 4. So there are a couple of treatments for it. So they're all very expensive. There is a medicine which replenishes the protein, so to speak. The body has a faulty gene. There are 2 genes in the body which make the same gene. The secondary gene, which is not very functional, there is a medicine that is given into the spinal cord which can make it work better. So this is called Spinraza. Similar medicine is Risdiplam. All these medicines at the moment are costing in crores per year, and you would have to continue giving this to maintain Vedansh's current level so that it prevents him from getting weaker. There is a single shot cure, so to speak, which you give 1 injection and then he doesn't need to take these medicines every day. So that would be what we call a cure, not a treatment. That for him, that is only eligible for children under 2 years of age. Vedansh is under 2 years of age. That is the gene therapy where the gene that is missing is packaged into a virus and given into his body so that this virus bears this good gene into all his cells. And they go and make sure that he has good protein. The good protein in the spinal cord where he needs to prevent him from getting weaker and it makes him stronger. So this works better in children under 2. This is a medicine called as Zolgensma, which costs 16 crores. It's 16 crores based on our exchange rate. It's $2.1 million US. More than 1,000 children have been given these medicines. They have been studied extensively for more than 10 years. So we know that this is a fairly safe medicine and we know it works. That is why it was approved. This is not an experimental drug. This is fully approved. And we've also given it already in our center. We've given it to a child. And we've got many children waiting for this. So we do know it works. Looking at all the other colleagues who've been working in the field. So it does work.
Before how many days, how many months time is there for Vedansh?
Till his second birthday, which I'm told is in September, isn't it?
Another 5 months.
Another 5 months. Okay. So without treatment, children will get weaker. So type 2s also have a risk to life. Without treatment, they can get weaker and they won't walk, type 2s. They would develop breathing problems, curving of their spine. Want to go? Curving of their spine and all the other things that go with it. Gradually they become weaker. If you don't take care of them, they too have a risk to life and sometimes don't survive.
And in later part of his life after this gene therapy, will there be any other complications associated with this?
So I don't think anybody in the world has an answer to that.
Okay.
So all we know is, as far as we've studied it for 10-15 years, that it is fairly safe. We have side effects even with the previous child that we gave. So we have to take care of the side effects. But risk versus benefit. Without it, they don't survive. With it, they have health. 15 years, 20 years, 30 years down the line, I don't think anybody has the answer. So far, we don't know of any side effects that we know of. This is the first approved gene therapy in neuromuscular disorders. So only time will tell. Vedansh has got his being young on his side. And I have no reason to doubt that he will not get some treatment. He should get some treatment and he will do well. The younger the child, the better they do.
Thank you, donate to save Vedansh. Please help us in this long journey. Thank you.
Please help us.